Hello, my name's Emma Knox and I'm the CEO of Vitality Health International Africa, which is a health insurer on the African continent. Welcome to our discussion today, which is about maternal health. Maternal mortality, which is the number of women who die during or due to childbirth, is very high on the African continent. Actually, almost 70% of global maternal deaths are recorded in sub-Saharan Africa. As a health insurer that's represented in 7 countries on the continent, sadly, we see a high number of claims, both in terms of maternal mortality and neonate. And today we want to have a discussion about why that is and what we can do to reduce it. I'm honored to have an expert in this field with me today. Welcome and to join us, Professor Salome Maswime. Prof Salome is a global maternal surgery expert and an advocate for women's health rights. She is a professor and the head of the Global Surgery Division at the University of Cape Town, as well as a director of the World Health Organization's Center for Integrated Clinical Care, and has been listed as one of the top 50 most powerful women in South Africa. Welcome. Professor Salome, please can you, in your own words, tell us a little bit about your background, experience, and why you're so passionate about maternal health?
Thank you so much. It's a great pleasure being here today. So I qualified as a medical doctor many years ago, and then I decided to specialize in obstetrics and gynecology, mainly driven by what I was seeing in working in rural hospitals, seeing maternal deaths that at the time looked preventable. I thought that, by specializing, then I'll be able to better treat the patients that I'm looking after. But even years later, as a specialist obstetrician and gynecologist, then I realized that the burden of disease is so high, maternal mortality rates are not the same. In some places, maternal deaths have almost been eradicated, but where I lived and worked in South Africa, in Johannesburg, maternal mortality was still very high, and in other parts of the continent, it was much worse. So I then did a PhD in obstetrics and gynecology, and later on, I got a Discovery Foundation MGH scholarship that allowed me to do my postdoc with the Harvard Medical School. And thereafter, I took a decision to go more broadly into global health as a discipline, ending up as the head of global surgery at the University of Cape Town.
Thank you. And can you tell us, before we get into the discussion, in your own words, what do you mean by maternal health?
So maternal health looks at outcomes that pregnant women have due to childbirth or within the 42-day period after childbirth or during the pregnancy. And of course, you look more broadly to say, how have the women's lives changed after having their deliveries? Whilst we only look at 42 days, but sometimes you'll have complications that might affect your function for the rest of your life. But maternal health specifically looks at childbirth, pregnancy, and the immediate month or so after pregnancy.
Okay, thank you. So at Vitality Health International, we provide health insurance cover in 7 countries on the continent. And some of those countries have extremely high rates of maternal mortality. Nigeria has more than 1,000 maternal deaths per 100,000 births. And countries like the DRC and Kenya have around 500. And to put that in context, I know the Sustainability Development Goal is for 70 per 100,000. What do you think is driving that high disparity or those high rates in those countries that I've mentioned?
So if you look at the African continent, first of all, we have the lowest number of trained specialists. So questions around who's actually doing the majority of the deliveries. It's not always the obstetrician. Even those who are doing the deliveries are not always skilled at doing them. Of course, in the facilities that you speak about, you probably have got the best people looking after the patients. But patients are in a system where you're only as good as your system, right? So even in a place where, yes, you've got the trained healthcare workers in this facility, you have to think about the care that the women are receiving throughout their pregnancy, their access to resources, all the other things, their health education, and all the other things that will determine what their outcomes are. And so there's a lot that goes into running a functional health system where you have good health outcomes. And some of it is the human workforce, the access to medicines, access to surgery, access to the right infrastructure, technology. And if those things aren't in place, you have patients who won't get the best outcomes, even in a place where perhaps it's a bit better than the rest of the country.
And what kind of interventions have you seen have made the biggest difference? So in a country that has high maternal mortality, what are the kind of interventions that take it to reducing those rates?
Yeah, so some interventions are big where, and will take many years. For example, if a country decides we want to increase the number of trained obstetricians and gynecologists, or we want to increase subspecialists, so maybe critically care trained obstetricians and gynecologists, and those would be the sickest patients in the system have access to the highest resources. So, for example, there's no safe surgery without anesthetists. So investing in anesthetists, etc., better ICUs, ventilation, etc., often results in better outcomes. But that's very expensive and may take many years to do. But you find things like improving ambulance services, right? Things like that tend to improve outcomes. So in South Africa and the Free State Province, a few years ago, that was one of the interventions where they said we're going to improve the pre-hospital care and the emergency services for pregnant women. And interventions like that have resulted in better outcomes because it means the sickest patients can get to where they need to be on time. But investing in training, maternal health training, building capacity also goes a long way. And I've seen a lot of interventions like that, basically quality improvement and capacity building interventions make healthcare better for women.
And what do you see the role of a health insurer in improving maternal mortality?
Yeah, so it's all about access, and affordability is one of the biggest components of access. And that's where I think health insurers come in as well, making healthcare more accessible to those who are able to pay for their healthcare. But also I've seen for an organization like Vitality, where you've created incentives for those that are insured, it also means that you end up with people that are generally healthier. Because what we've seen is that for the women that don't attend antenatal care, they have the worst outcomes. For the women who aren't taking their vitamins and all of that will have worse outcomes because they haven't been looking after themselves throughout the pregnancy. So things get detected very late. And so I think health insurers play a very big role in improving accessibility and managing affordability for care for those who can afford.
And we know that health technology is developing very fast globally. What do you see as the main changes or main contributions that can make to improving maternal mortality?
Yeah, so I often say that technology is excellent, right? And we've seen how it's been rapidly used and it's rapidly growing in strengthening healthcare systems, but it also has to be context appropriate. So it shouldn't be a rush to see who's going to get their app fastest into the market. But there are many things. So for example, a few years ago, I reviewed a proposal for a study that was going to look at so preventing preeclampsia, for example, which is a common complication of pregnancy, hypertensive related disease, creating apps that are able to detect some of these things before the women get to hospital. And so there's been a lot of creativity in how technology can be used for diagnostics, for screening, for health education and health promotion.
And do you see technology being able to bridge some of the gap in having the healthcare professionals that you need in each country? And if so, how?
Yeah, so I mean, for example, technology is used for teaching, for training, I mean, virtual reality. So from previous days where like you actually had to go into a theater, assist someone with surgery to learn how to do some surgical procedures, now you don't. You can learn some of these things through virtual reality, through simulations, etc. And the more we embrace technology, the better trained clinicians you're able to produce. So it has to be two ways that we embrace technology and advances and we start to use it, but there has to be acceptability as well. I do find that, for example, before COVID, people were not very open to telemedicine, but these are things that are very useful when done appropriately by the appropriate people.
And you've been working in this field for many years as a maternal health expert and advocate for women's health. Do you have a story or a case you can share with us where there's been a positive impact?
Yeah, so one of the initiatives that we've certainly had within our division of global surgery is a program that we call the Anesthesia Launchpad, which we ran in the Eastern Cape province. It still continues to run, but this was really looking at, okay, what are the problems that we want to solve in many of the hospitals? The surgeries or the cesarean sections are done by junior doctors, and the junior doctors are providing both the anesthetic and also providing and doing the cesarean section as well. When the patients run into anesthetic complications, they don't always know how to manage them. And so skills such as doing general anesthesia for a patient that's having a complication were not, you'd find many of these doctors don't know how to do this. So we developed a short program where we'd train the medical officers on safe anesthesia, but in the long run, you know that it's not just safe anesthesia, but you're making them safer during cesarean section and other surgeries that they are doing as well. And so that's an example of a quality improvement program that I've been part of.
Prof Salome, could you tell me a little bit more about your research on the continent?
Yeah, thank you. So a lot of my research has been on cesarean section outcomes, and particularly we did the African Surgical Outcome Study where we looked at the cesarean section outcomes. In this study, we found that African women were 50 times more likely to die from cesarean section complications than women in high-income countries. And this was related to what we call failure to rescue. Failure to rescue means that patients will have complications, but if you're not able to manage the complications that they have, then you'll have more patients dying. And this really spoke to health systems issues. And so it just shows that in countries and communities where health systems are not strong, patients will have worse outcomes, as they did in this study.
Thank you. And would you like to close off with a few final words on where you see the future of maternal health in Africa, and what can private sector health insurers do to contribute to reducing maternal mortality rates?
So I think it all has to be a partnership at the end of the day. I think one of the issues is that we're not talking to each other and like everyone wants to solve their own problem. But for the patient isn't splitting in their minds. That's private sector, that's public, that's academic. For the patient, they want the care that they require when they are sick, and a mother losing a life, it's to that child. If the child survives, it's the husband, it's the family, it's losing a breadwinner, it's so many things. And so I think if we start to partner to develop programs that will better improve maternal outcomes, then our patients as a whole will get better outcomes. So my recommendation is that as health experts, as private sector, public sector, as academics, we all have to come together and start partnering with government as well to come up to tailor make context specific solutions in places which have the highest maternal mortality rates.
Thank you so much for your time today. I agree. I see a huge, tremendous opportunity for partnership to improve maternal health. At VHI, We take child and maternal mortality very seriously. We have a very young population that we insure on the continent, and we see, a number of claims around maternal and neonate mortality. So it's something we take very, very seriously, and I look forward to us and you being more partners and being able to make an impact on the numbers that we see on the continent. Thank you.